There are many procedures to confirm the diagnosis. The first one is a cutaneous biopsy using an immunofluorescent antibody staining because this is the most safe to analyze the animal brain tissue. Then, a rapid fluorescent focus inhibition test measures the antibodies that neutralize the rabies in a culture of in vitro cells. It tests positive in 48 hours. The serum neutralizing antibodies is a blood test that allows to detect antibodies until the sixth day of the illness. A spinal tap may be done to look for signs of the infection in the spinal fluid. An early diagnosis can be established by the Rabbie RNA detection. Differential diagnosis. This illness can be confused with tetanus and encephalomyelitis. Tetanus and rabies present muscular spasms. However, rigidity is presented between each spasm in tetanus. Furthermore, the incubation period is very short in comparison to the rabies one, and the lack of hydrophobia is another difference in tetanus patients. Then we have the treatment. First, it's necessary to wash with water and soap and scrub vigorously the bitten area or the wound, taking care of prophylaxis for tetanus and the bacterial infection. Then it's very important to take the decision of treat or not treat a patient. That will depend on many factors that are summarized in the algorithm. If a person was bitten or was exposed to a wild animal or to a rabbit acting one, it will be necessary to take the animal to analysis and observation. If the animal can be captured, the treatment should be begin immediately. There are different kinds of vaccines, like vaccines for humans prepared in human diploid cells, the purified viral cell vaccine for humans, the purified tick embryo cell vaccine for humans that are international standard rabies vaccines. If the treatment has begun, the vaccine should be applied. Both the dose and the time will depend on the exposition. We have pre-exposure dose. This one is recommended for the people in constant exposure to rabies animals, like the vets. They should receive 3 intramuscular injections of 1 milliliter of any of the anterior mentioned. The second one should be received 1 week later, and the third one 2 or 3 weeks after the second one. The serum antibodies levels must be determined from 2 to 3 weeks after the last dose of the vaccine to ensure a satisfactory answer. A recharging intramuscular dose of 1 milliliter should be applied every 2 years when the exposure risk continues. Then we have the post-exposure dose, when the therapy begins after the illness has been diagnosed. Human immunoglobulin is administered in a dose of 20 micrograms per kilogram, with half of the dose infiltrated in the wound and the other half in an intramuscular way. At the same time, 1 dose of 1 milliliter of the vaccine for humans prepared in human diploid cells must be applied in an intramuscular way and must be repeated at 3, 7, 13, and 28 days after the first dose. An already immunized person must receive 2 doses of 1 milliliter and 3 days later another one. In this case, human immunoglobulin is not indicated. People taking care of the sick person need to be vaccinated and wear masks, gloves, and coats when being in contact with the patient. In a different way, the patients or sick people must be treated in an intensive care unit. The ones who suffer from the acute form of the illness will require intensive monitoring of the cardiovascular and pulmonary activity, the electrolytes, and parenteral liquids. The hydrophobia can be reduced with phenothiazine mixed with benzodiazepine.